Hey girls, so it is time for my week 21 pregnancy vlog. So this week, not a whole lot has happened yet. I saw my doula yesterday and that was really nice. We got to, mostly our prenatal yesterday was just going over my medical history. The idea is I'll get to labor at home for as long as I want to. So by the time we get to the hospital, I'm not going to be in the mood to answer questions about my medical history or anything like that. So she has all the answers to all the standard questions that they ask you in the hospital, so that, you know, she can answer for me, and then I just will nod and agree that that is right, which is really nice. And also, since I am high risk and I have the blood disorder, and she's just going to do some research and see if there's anything that she can find out to help me as well, and just to understand what it is that is going on with me. So yeah, and then mostly the other things that we talked about this time were, and she's going to email me something, but she hasn't yet, like a list of all the things that I will have a say in when I'm in the hospital. Like, do I want to see my placenta? Do I want to keep the placenta? What can be delayed for the baby until, you know, after we've nursed and had skin to skin and I've met and bonded with the baby, and what is mandatory that has to be done by state law, and just a list of things she wants me to research and know how I feel about them and when I want to do them or if I want to have them done for the baby. So she said, you know, I'll send you the list. You can look over and kind of write down your thoughts, and then we'll go over that at the second prenatal appointment. And the second prenatal appointment, we're also going to start writing like my birth preferences, and then that'll be the end of September that I have that appointment, and that gives me enough time to meet with my OB and talk with my OB about a lot of things are going to be up to the OBGYN. Like, if I don't want an IV, I have to negotiate that with them. They each have their own policy, every doctor and hospital. So one thing I think I'm going to do between now and then is take a tour of the hospital. I know I delivered there last time, but I walked in the door last time just saying I want an epidural. Like, before I was even in pain, really, I asked for an epidural because that's like what everyone I know who's had a baby did, and they all told me, make sure you ask for it before you need it, because they have to give you like an IV with fluids, and that takes a while. Like, that can take 45 minutes before, once you request it, before they can even give you the epidural. So yeah, I just asked for it as soon as they broke my water, and I walked in the door knowing that's what I wanted to do that time around. And I was pretty naive then, and I'm glad everything worked out. But yeah, so that is what happened last time. So I didn't talk to the hospital about what my natural pain relief options are. So, and just the things they have to assist in natural childbirth. I did ask my doula how she felt about the hospital I was delivering at. And in my area, she said it is her second choice. And we have a lot of hospitals, so her second choice is not bad. She did say there's another hospital that she prefers for natural childbirth, and the only problem about that is my OB only delivers at the hospital that is my first choice, but it's my first choice because that's where my OB delivers. So, and I really like my OB. So I'm a little torn. The reason my doula likes the other hospital the best is because every single birthing room has a tub in it, and you can labor in the tub, and at that birth center, or it's a hospital, but it's a maternity center. They have the fetal monitoring that is portable, so, and waterproof, so you can, if you have to be continuously monitored, you can still get out of bed and you can get into the tub even if you want, even if you have to be continuously monitored. And it's the only hospital in our area that has that. But she did tell me that the hospital I want to deliver at is going to get them. It's just a matter of if they get them in time. So I kind of have a question for you girls. If you are happy with your doctor and you're halfway through your pregnancy, would you mess around with finding another OB that would deliver at the other hospital? Having hydrotherapy is important to me. It's really important to me. That is a way I naturally relieve pain whenever I have pain. I get in the bath, and I really want that to be part of my birth experience. Not having a water birth, none of the hospitals around here allow that, but to be able to labor in water. The hospital my OB is at, they have 3 rooms with a tub. They're first come, first serve, and every room has a shower. So, I would still have water. I just might not be able to, it might not be a tub. And I asked the doula what the chances of getting one of the 3 rooms that have the tub in them, and she said actually really high, because you can't be in one of those rooms if you're induced. If you have to be continuously monitored, you can't be in one of those rooms. And if you have an epidural, you can't be in water. So there are a lot of things that would kick you out of one of those rooms. So she said, you'd probably get one if you wanted one of them. So that's good. But I do want to go talk to the hospital and see what the hospital has to say about how frequently those rooms are open. I want to see if one happens to be open whenever we do the walkthrough. So I really don't want to change my doctor just to get that hospital, but it is an important part of what I want in labor. So I don't know. That being said, I want to labor at home as long as I can, and I will have a tub here, so we'll see. And I have some baby buys, and we've done some things in the nursery, so I filmed a little clip of that. I'll put that in here. Also, I measured my own fundal height this week, and I'm measuring like 24, so about 3 weeks ahead, and I've been really crampy, almost to the point where I've called the doctor. And I didn't call the doctor, but I was getting worried. But then all of a sudden everyone was like, your stomach really grew this week. And so that's when I did the fundal height measurement, and yeah, it's like 3 weeks ahead. So I think we had a growth spurt. I don't know, but I have an appointment on Monday, so it's not like I'm putting off seeing the doctor forever. Yeah, and the cramping has kind of subsided now, so it might just have been one of those things. I see the high-risk doctor on Friday. It's a different high-risk doctor. It's one that specializes in maternal and fetal hematology. So he's the one I went to. He's the blood guy that I went to last time to try to help get my hemoglobin count up. And so I see him Friday, and his policy is to do an ultrasound with his patients every time. So I'm guessing we'll get an ultrasound on Friday, and that's exciting because I really want to know how big this baby is. She's measuring even more than a week ahead, because she's always been at least 1 week ahead. So that'll be interesting. And then Friday I also see the chiropractor, and Monday I see the OB, my regular OB. So lots of doctor's appointments. Next week's update will probably be about all of those. So, but if you guys have any questions, feel free to leave them below or message me, and I'll either answer you or post the answer in the next vlog. So thanks for watching, girls. Bye. Okay, so I definitely forgot to do my belly shot, so I'm going to go ahead and do that now. Alright, so here is the belly. I just think it grew a lot this week. I don't know. I can feel kicks all the way up here now. So, open from the front, from the side. So, there she is. I'll show you with my shirt down too. Alright guys, I just wanted to show you the progress we've made in here so far. We did get the room emptied out mostly, so that's good. And you can see some of our baby buys this week. Well, here's the closet, and these are just, you know, things we have so far. All the bedding and stuff is right there and back in the corner there. And then we got this changing table. We'll get like a dresser one eventually, but for right now, we got this one. Got the diaper genie today, and we got the changing table this week also. You can kind of see we've just laid some things out. We have her cloth diapers right here, little newborn and 0 to 3 month undershirts. Then in there, those are all my cloth breast pads. Back there, lotion and the bulb syringe, and down at the bottom we have some of the muslin swaddling blankets, and then some of the little blankets that you just put them in and they velcro when they're swaddled. Here are more cloth diapers. We use these for like spit up and stuff, and then some just smaller swaddling blankets, and we actually use these to put up here on top of the changing pad cover, so that if there is a yucky mess, we can just peel that off and wash it right away. It works out really well. So yeah, so I know it's not much, but like we do have all the bedding, and we just don't know if we need to buy another crib yet or not. So we're just kind of waiting to see what Connor does. He jumped out of his crib a couple days ago, but he hasn't tried since then. So I don't know. And you see that would be Connor's toy. But yeah, so it's coming along. It's emptied out. We'll have a rocking chair there, and we'll put that in Connor's room. The rocking chair is in his room right now, and then the crib, we just have to figure out if we need to buy another crib or a toddler bed or what we're going to be doing for that. So another thing that we need, which we're talking about just leaving it in the hallway, is a cloth diaper pail. Connor has one in his room, and then he has the diaper genie. And the diaper genie, we just put the wipes and liners in. And then in his little pail is where we put all the diapers. And we're seriously considering just putting the diaper pail for the cloth diapers in the hallway, like right outside their doors, because their doors are like, here is this one, and then the other one is right there. So we're just thinking about putting the pail right out in the hallway, because once it's full, we're just going to do diapers. We're not going to do hers and his, so they might as well be together. And we're waiting. I'm probably having an ultrasound on Friday, so I just want one more confirmation it actually is a girl before we go ahead and paint the room and everything like that. So as soon as we have another ultrasound, we will start painting. So yeah, but that's what we have so far. So let me know if you guys have any questions. Thanks for watching, girls. Bye.